Hello everyone, my name is Al Clancy. I am the Director for Training and Compliance for Health Plan Markets. I'd like to welcome you this afternoon. It's a beautiful day this afternoon here in Winter Garden. There is a topic that I will be diving into a lot more deeply as the rest of the month of March and April come through. But I wanted to just kind of throw it out there to you now. Just get your radar up. Start reading a little bit about it, start understanding it, and so it's something that I think is going to be very important for all of us who are in the insurance business, and certainly a number of Medicare beneficiaries as well. This program that is kicking off is called the Medicaid Redetermination. Now, what that means is that everyone who is on Medicaid is going to have to reapply, recertify, be redetermined whether or not they are still even eligible for Medicaid, and if they are eligible, at what level, and that level may be different than the level that they are currently on. So I wanted to spend just a couple minutes today briefly outlining what happened and why it happened and how it happened and all that kind of stuff. So essentially we're coming up on the 3rd year anniversary of the start of COVID, right? My wife and I were in Hagan O'Reilly's Irish pub on St. Patrick's Day, March 17th of 2020. And at 5 o'clock, the Winter Garden police escorted everybody out of the building and they had to lock it and secure it. That was the start of the pandemic. So essentially, what has happened since is every single person in the country who is on Medicaid has been able to retain Medicaid and has been able to retain Medicaid at the level that they were in March of 2020. With that comes some potential issues with qualifying for dual plans, for example, qualifying for certain state and federal programs. So the government decided that they would begin this redetermination process now. So it's beginning now. So essentially what happened, just to give you the full vision here, is that in right after the pandemic started, the federal government declared a public health emergency, and no one knew at the time how long that public health emergency was going to last. As time went on, it was pretty easy to see that this was not something that was going to go away in 2 weeks. So this public health emergency was declared. With that came the situation and the issues about people with Medicaid. Conversations went to the fact that, what are we going to do? It's going to be really hard for us to find these people, for them to complete applications on a yearly basis. So the federal government decided to somewhat freeze their Medicaid level, and at whatever it was at the time of the start of that public health emergency. And so we've now gone 3 years, and these folks with Medicaid have not had to recertify themselves or become redetermined. So they're on the same level of Medicaid today that they were on in March of 2020. I'm sure that many of you, your heads are already spinning and saying, well, oh my goodness, that could cause some issues. And it can. And I'll talk about those in just a few minutes, but I want to kind of give you some of the underlying information. So the redeterminations are going to begin here in Florida on April 1st. So we have a few weeks yet before they start. So I'm going to tell you 2 websites or 2 places to look on the internet to try to get some more information that's going to be accurate information. And then I'm also going to let you know that I will be doing live face-to-face training class, at least one, if not more than one, and I will be doing some recorded trainings and also some webinars as well. And I will be speaking at the April 23rd Health Plan Markets agent event as well. So, and I'm going to be talking about this topic, so you're probably going to see more of me than what you really want to, but I think this is important. So essentially, here's the Medicare redetermination. So once again, in March of 2020, there was an act passed by the federal government called the Families First Coronavirus Response Act, FFCRA. You will hear it called Families First. That's kind of the or the Families First Act. So you'll hear it in that light. So essentially what that means is that the federal government promised the states, because Medicaid is administered by and funded primarily by the states, not the federal government. So the states are thinking, oh my gosh, what are we going to do if we can't police and determine who's on Medicaid and who's not on Medicaid? How are we going to pay for this? So that's the federal government came up with this act. So they're providing the states with additional funding for their Medicaid programs as long as they promise, the states promise, not to disenroll people until the end of the emergency, and the emergency is coming to an end. Every single state accepted the money. So it wasn't as though, Florida took it and Alabama didn't take it. Every state took it because they could all see what that would do to their state budgets if they didn't take it. So the public health emergency is good technically through May of 2023. And then there's a new act that is in place beginning April 1st called the Consolidated Appropriations Act of 2023. And that act is giving the states a little bit more funding to be able to research and recertify all of the folks that are on Medicaid, and then begin to terminate those Medicaid contracts that are no longer valid. Now, I will pause here, and anybody who has ever worked with the low-income Medicaid folks on if they have dual plans or whatever they might have, that they are very hard to keep track of. Their phone numbers change somewhat frequently. They move somewhat frequently. They live with other family members. I've heard of a lot of situations where mail has been stolen out of their mailbox. So this is going to be a very, very difficult time for the carriers to be able to get through this process, and for the states to be able to get through this process. The states must do this using the U.S. Postal Service. So before they can do anything, the federal government is requiring them to run their entire Medicaid database through the United States Postal Service change of address database, so that the federal government knows that the states are doing everything that they can possibly do to have the most accurate current address for these beneficiaries. The states cannot disenroll if they get a piece of mail back and it says undeliverable. They can't disenroll them. So that's where some of this additional funding is going to help the states until they can find these people and figure these people out. So here's probably one of the most important statistics that I've found, is that the Health and Human Services, the federal government, estimates that somewhere about 15 million Medicaid beneficiaries will lose their coverage. Now, how would they lose their coverage? Well, they could lose it in a number of different ways. If their income changes, if their assets change, if they had a family member who passed away and left them money, and now their assets are too high. If they got married and their joint income is too high for the Medicaid level, or even worse for us in the Medicare space, is that when you enrolled them in, let's say you enrolled them earlier this year, they turned 65 in January of 2023, and they're Medicare eligible, and they showed you their Medicaid card, and their Medicaid level is QMB plus. It might not be QMB plus. when they go through the redetermination. It might be Slim B. It might, who knows? There is all kinds of chaos that can occur with this, but I think that we in this business at this moment in time right now can be the ones to really bring this thing home. And understanding this rule, how it's going to work, the timing of it, and getting in contact with every single one of your Medicaid members. And you might say, well, I don't sell Medicaid, I don't enroll people in Medicaid, but you have a part to play in that if they're on a dual SNP plan, a dual special needs plan, because they have to have Medicare and Medicaid to get on that plan. Also, as I understand it, I don't work in the ACA side of things, but there are some opportunities for people to have Medicaid, but to still have an ACA plan as well. So there are things that we can do in our business to really help at least our members. But here's the thing, I think this can become a wonderful prospecting opportunity for you, because I believe that if you go to a senior apartment community, low-income senior housing, and there's 54 units in a 3-story building, and if you go there on a regular basis, then remember that everybody that's in there is on Medicaid. Everyone in there is a senior, but how many of them have agents? And how many of them are going to understand this document that's sent to them by the state of Florida? So you can become an incredible resource. And if they need to move because of their Medicaid status changing, then you're there to help. Additionally, there are a lot of folks on Medicaid who were working, but they just didn't make enough money. I think the limit was $12,999 or something in that general range. But if they over 3 years, if they got raises, they may be booted off of Medicaid entirely, because now their income is in excess of those thresholds. So you may need to come in with an ACA plan if they're under 65. And of course, if they're over 65, making sure they're on the right DSNP plan. They may have qualified for QMB Plus, and you've got them on, the top of the line product there. But if they are dropped down to Slim B, you may need to have different conversations with them, or at least let them know what their benefits are going to change to, if they are going to change. If somebody loses their Medicaid and they need to get on an employer-sponsored group plan, for example, if they're under 65, or even if they're over 65 and they're working and they have the ability to do that, it may be less expensive for them to do that than it would be to go on any other plan if they're under 65, for sure. But it could be an ACA product. It could be an employer-sponsored plan. So loss of Medicaid receives an SEP opportunity. So just so that you know that. The government is expecting this to take about 14 months from the time it starts in just a few weeks, April 1st. They're expecting it to really not all the dust settle until the end of June of 2024, maybe even longer. So the issues that the beneficiaries are going to face can be devastating, and we want to make sure that, at least with regard to their health care and making sure that they're on the right Medicare Advantage plan, or that they're on the right ACA plan, is of paramount importance. And if you play your cards right, remember that there are an awful lot of people that signed up for these plans, calling Joe Namath and William Shatner and J.J. Walker and whoever else it was that were on those TV commercials. And a lot of these folks just called the carriers directly. So a lot of these folks do not have agents of record per se. And you might be able to go in and work with some groups if you work at senior housing facilities, if you have relationships, if you have relationship at food pantries, at churches, if you have relationships at any kind, a fitness location that is, that's held in a, in a community center or something like that, exclusively for seniors. Go in and spend a few minutes, do your research, have your language correct, and go in there and talk to the director and say, hey, listen, I've got 4 people here, and I am really watching this very closely when they go through this redetermination to see where they're going to land on their Medicaid level, and then I'm going to be right here to be able to get them moved over to the right plan for the right reason for whatever situation that they're in. So once again, thank you for spending a little bit of time with me today, but I'm going to do much more extensive. It'll probably be a good hour and a half training class. I'm going to attempt to deliver it and record it, but I'm also going to attempt to do a couple of live ones and also some live WebExes as well. So please, here are 2 websites. I encourage you to go and do some research. You know, I am not going to be able to take everyone's phone call and say, you know, well, what does redetermination mean? I'm not going to be able to do that. But you can go to 2 sources of truth, and I think that those are important to identify. The first one is Google. Google's my friend. Love Google. So type in Medicaid Redetermination Florida. Those are your 3 words. Make sure there's a space between them. Medicaid Redetermination Florida. If you're up in Georgia and you work with Gail, Medicaid Redetermination Georgia. If you're out in California, Medicaid Redetermination California. And you'll get more information than you will be able to go through in a week. The second resource that I would tell you to open your eyes to is called kff.org. So that is going to be Kelly Frank, kff.org. That is an arm of the Kaiser Family Foundation, and they do a tremendous amount of great work in the business that we're in healthcare. And they really have a lot of information on their website about the redetermination, and they really get into the weeds. So if you're a techno geek and you really want to get some information and have some ammunition in your pocket, kff.org is where you're going to find that information. You're going to just have access to charts and graphs and statistics that you would not believe. And I'll be using some of those at my classes. But for today, I just want to kind of get you off and started. So thanks once again, Al Clancy, Health Plan Markets. I hope that to see you on one of my training classes. And also I will be covering this topic at our HPM agent event on April 23rd. You all should have received an invitation to that. This might be a good reason to come so that you can learn a little bit more about this before we hit May 1st. Thanks. Have a great evening. Bye.